and she will be talking about human psychological, sociological impacts. Our next speaker will be Dr. Phillida Charley. She is a postdoctoral fellow in the the Department of Environmental and Radiological Health, and she will be talking about impacts on Native American communities. And finally, Dr. Pat Alois Young is an associate professor in applied social and health psychology, and she will be talking about behavior changes that resulted in decreased carbon emissions and their sustainability. So I guess without further ado, we'll go ahead with Rebekah to introduce us to bats and coronaviruses.
Thank you, Carol. Can everyone hear me okay? Okay, great. Well, it's really an honor to be included in this panel today. Thank you very much for the invitation. As Carol mentioned, I'm in the Department of Microbiology, Immunology, and Pathology. And my laboratory focuses on the transmission and ecology of vector-borne and zoonotic diseases. And so we do a lot of work with mosquito-borne viruses, but we also have a component of our lab which studies viruses in bats and the ecology of which viruses persist in bat populations and potential for spillover to humans. And so that's where I enter into the COVID story, as coronaviruses are reservoired in bat populations, and there's an evolutionary association with beta coronaviruses and alpha coronaviruses with bats. And so the story for me started about 10 years ago. I was working at the Centers for Disease Control, and we were doing virus surveillance in Uganda. And I've got some visual aids here pictured for you. And so the surveillance was looking at emerging viruses in mosquitoes, but we also were identifying blood meals from mosquitoes and picking up blood meals from bats. And so then I got interested in bats and what viruses bats could be carrying. And so we started to investigate that further, and it's since evolved to more of a looking at the ecology of specific viruses in bat populations and how they circulate in that human-bat interface and risk for spillover. And so currently we have a funded project in Uganda, along in eastern Uganda, in a series of caves that are inhabited by predominantly Rhinolophus and Hippociteros species bats, which you see pictured on your upper right, that's Rhinolophus. So this is the genus of bat that has been associated with SARS-like coronaviruses. And so coronaviruses have always been kind of at the top of our list of viruses of interest in this environment, as a place where people are entering caves on a regular basis. You see the gentleman in the green shirt at the top of the screen. That's one of our primary caves where we're working in that has Rhinolophus bats in it. And so we're interested in understanding more about the vulnerabilities of this type of situation and behaviors, which local people, as well as tourists, are encountering these bats. With what frequency, what is the nature of interaction with bats, and what's the risk of spillover. So we will be sampling the bats seasonally. We'll be tracking their movements with GPS tags and pit tags and looking at viral shedding, also looking in the human population and understanding more about what their cave entering and bat association behaviors are, and integrating those in a true One Health context to understand more about the nature of pathogen movement. In the bottom right, there's a picture of me making new friends. This is something that's really important to me with this work, and the emphasis on community engagement and developing relationships with the people that you're working with over there. So it's something that we want to understand that, you know, this is a health impact on the communities, and how best we can serve them with the work that we're doing. And so it's been a really interesting space to be in, and a really important and impactful one, because it's a public health question and also one that's very important to wildlife conservation. And so that's been kind of during this pandemic period and period of quarantine, I've been kind of a bridge between those two worlds with understanding the virology and the public health impact of this virus, but also keeping in mind that bats are really critical to our environment. They provide ecological services such as pollination of plants, seed dispersal, consumption of agricultural pests. And so they're really important, and there's many of them that are critically endangered. And so while we have to consider that some of them are reservoirs to viruses that have significant public health consequences, to be respectful of the conservation end, and how do we message appropriately and actually learn to live safely with bats, because there's definitely a fear factor involved with how people can react very strongly against bats. They already have the Halloween thing working against them, right? And so that's been kind of my mission field during this pandemic. I've been serving on the International Union for Conservation of Nature Bat Specialist Group, a specific working group with people from all over the world who study bats from many different perspectives, to talk about, not only there's the public health question, but also from the perspective of bats. What is this outbreak? What is this pandemic? The impact that it has on bat populations, and actually, is there risk of spill back? And so we think about, spillover of pathogens from wildlife to people, but this is actually a cross species, transfer, not of that could happen. And so if bats or other wildlife species were to be exposed to SARS-CoV-2, could there be an establishment of a reservoir? And what epidemiological significance would that have? And would there be an effect on the health of the animal? And so those types of discussions have been very actively happening amidst this pandemic. And there was also a panel, an expert elicitation panel that I served on with USGS and US Fish and Wildlife Service to have this discussion about the risk of North American bat species in particular to SARS-CoV-2 exposure. And so there's been, it's been an opportunity as I've looked at it to engage in some discussions where there's been a lot of conflict in the past with kind of merging the significant questions of ecology and conservation. I think this pandemic has kind of presented an opportunity where this is an issue of common ground, of concern to very diverse research communities, where we can come together and bring together expertise to tackle it together. And so that's been my involvement during the last several months.
Thank you, Rebekah. I think we'll save questions until after everyone has spoken. So our next speaker will be Susan DeLong, and she'll go ahead, Susan.
Okay, thank you, Carol, and thank you so much to this organization for the invitation to be on this panel tonight, and thanks, Rebekah. That was super interesting. I'm looking forward to hearing what everyone else has to share. So as Julie said, I'm Susan DeLong. I am faculty in our Department of Civil and Environmental Engineering here at CSU. And historically, I have worked on the application of molecular biology methods to a variety of engineered systems. So I've worked on things like how can you use molecular biology tools to understand bacteria that clean up oil spills? That's just one example. So when this pandemic came along, I was contacted by various entities in the wastewater field, and I environmental engineers work with wastewater as well. I work with degradation of contaminants in wastewater, for example. So folks in the wastewater industry contacted me and said, "Can you, measure SARS coronavirus in wastewater?" And the answer to that is yes. And I've teamed up with a variety of people, including Carol Willis here at CSU, to do this work of wastewater monitoring or wastewater epidemiology. So we know there's been studies monitoring the SARS-CoV-2 virus in wastewater in Europe, where early on in the pandemic, establishing that this method does work. And so when we jumped on, we had certainly methods and information to begin with. So the way that this works is that we collect samples from the influent of wastewater treatment plants, and we measure levels of the virus in that wastewater. So the value of this wastewater epidemiology really comes because it provides an early warning system for viral outbreaks, because we know people will shed, if they become infected with this SARS-CoV-2, they will shed the virus in their feces within a couple of days of infection. And they will shed, so they're shedding the virus when they're pre-symptomatic, before they will realize they're sick, go to the doctor and request a clinical test. And even if people are never symptomatic, so asymptomatic people will also shed the virus in their feces. So we can get a gauge on the levels of virus in our communities by monitoring wastewater at a very, very low cost. Tens of thousands of people are being monitored in a single sample, and it gives us a sense of how our entire community is doing. So at CSU, we're doing this COVID wastewater monitoring for the state of Colorado at 17, I think we have 20 now, actually, 20 wastewater treatment plants across the state. And then we're also doing this at the level of dorms on the CSU campus. For the building level monitoring, you can follow that up by testing people that live in that dorm or that building and identifying infected individuals, moving them to quarantine and hoping to prevent outbreaks. At the level of cities, the Colorado Department of Public Health and other departments of public health are using this wastewater monitoring data as a line of evidence, another piece of data on where we are as various communities to make the plan is to use this data to make decisions about our social distancing status and whether or not schools are open and that sort of thing. So just quickly, the way this method works is that we're taking 24-hour composite samples, whether that's at the dorms or at the wastewater treatment facilities. So that means over a 24-hour period, we collect a little bit of water every few minutes. From those 24-hour composited samples, we have a protocol for extracting essentially the genome of the virus. So the process involves removing solids, concentrating the virus. You can imagine that this virus is present at very, very low concentrations in wastewater. So we concentrate it on this Innova Prep gadget here, which has an ultrafiltration system. And then we extract the viral RNA and we measure the quantity of the viral RNA, that's the genome of this virus, it's an RNA virus, using a method called reverse transcription digital droplet PCR. And I won't go into all the details of that, but unless someone wants to ask a question later, but this allows us to get a concentration of the virus per liter of wastewater. All of this data then is put together on an internal dashboard that the departments of public health use to understand how the levels are changing over time in the various communities across Colorado. This has been a tremendous collaborative effort, so I'm really here on behalf of a lot of people who contributed, and I think I can maybe leave it at that for now and then answer more questions.
Okay, thank you, Susan. And I want to mention, if you didn't hear Candy say it, that if you would like to ask a question, please register it on chat, and we'll go through there and hopefully get all your questions answered. So our next speaker will be Dr. Lise Youngblade, and she will talk about the social, psychological, and emotional impacts of this prolonged pandemic.
Thank you very much. And wow, what an honor to be on a panel with these amazing scientists. I have enjoyed both the talks, and likewise, I'm looking forward to the rest of the talks, learning quite a bit. So by way of introduction, I'm trained as a developmental psychologist with a specialty in social emotional development, but I've worked really as an administrator over the last part of my career. So I have to admit, I am not actively active in the science of COVID, but definitely have been spending a lot of time thinking about it from my disciplinary training, especially as it impacts the job that I do, which is to support faculty, staff, and students. And I don't think it's of any surprise to you, having experienced this, that we do see significant effects on mental, social, and emotional health. We've been very importantly focused on testing, on vaccines, and so forth. I think not quite as honed in yet to the scientific study of the impact of COVID on mental and emotional health, but we certainly can draw from what we know from other research and apply it. So we know there's significant effects, and I know as I talk about them, you're all going to probably nod your head maybe and resonate, because I imagine you've been dealing with some of these yourself, as well as in the people that you are associated with. So I'm going to talk just in snippets about kind of each of these core areas. So first, really wanted to talk a lot about some about stress coping and resilience. And no surprise, a lot of the stress we're facing right now is from the uncertainty of COVID. It's long-term, it's complex, it affects all different aspects of our lives, how we balance work and family, how we integrate in our communities, how it affects our economy, our schools, and so on. And COVID taxes us all. It has an impact, but it taxes us all differentially. But what we know sort of underlying all of this is that prolonged stress isn't good for us. It's not good for us mentally, and it's also not good for us physically. When we're stressed, we elevate we produce elevated cortisol, a stress hormone in our body, which is extremely adaptive in the short term. It stimulates fight and flight. But in the long term, it depletes our body and puts us at increased risk for very long-term chronic things like increased blood sugar levels, which leads to weight gain, suppressed immune system, and digestive problems, can be implicated in heart disease. It's also increased or linked to an increased risk for mental health issues as well, anxiety and depression. So we know this, we know stress is not good, and we know this sort of innately because all of us react to stress in some way by coping, and we cope in a myriad of ways. We do this in things like reminding ourselves to breathe deeply, to calm down, to eat right, to exercise. We also access formal supports, counseling, and so on. And even if we just look at the rates of access of the mental health services for students on this campus, and we look at community supports, we're seeing elevated access of these services. It's a great thing. It is indicating people are reaching out to supports to help with some of the effects of this. We also access informal supports, friends and families, and we control what we can. We find the things where we can control because the rest of our experience might feel like it's something we can't control. So in just giving an illustration of many different ways that people cope, there's no right way to cope. But I think the key thing that we've learned from research about coping, about stress, is the reaction of being mindful to what the stressor is and what the desired outcome is sort of key to having a healthier approach to coping. One of the words that we hear about with stress and coping is the word resilience. I'm a psychologist, we think about this term all the time, and I imagine as scientists we think about this too in various ways, and certainly talk about it a lot in terms of navigating COVID. And I have reflected on this a lot as a leader, that I spend a lot of time talking about how my college, different units, faculty, and so on are resilient, and they are, and I am so very proud of them for being so. But I worry a little bit about the double-edged swordedness of this, and that's due to the fact that if we're talking about a community or a unit or whatever group as being resilient, what about that one person who at that moment is not feeling resilient, right? So it's tough to feel successful if the rest of the community is perceived as resilient and you yourself don't have that resource to feel resilient in that moment. And this is a double-edged sword even more in the current environment, because one of our key sources of support in being resilient are our mentors, our colleagues, our friends, all of whom themselves are by COVID. This is, for me, something I've been thinking about a lot, the use of words like resilience that have a very purposeful, positive intention in how we think about using them, and oftentimes are motivating and very, very true. But with that added nuance of, okay, who's not feeling resilient right now and how we're adding to their stress, and are there ways to support them? So another area that I think is really profound and just serendipitous and such great timing that President McConnell sent out her email on Monday where she talked about grief. And we have a lot of research on grief and how it affects us, particularly long-term unmitigated grief. But COVID's interesting in this way because it's evident in a lot of ways. The obvious one, we have grief because of illness and because of loss of family, illnesses and deaths, but it's really existential grief too, because we're grieving something that's not normal anymore or how it used to be, in combination with this uncertain path forward. So I think grief is another thing we really need to pay attention to in our interactions and thinking about how we're coping, how we're responding to stress. We crave social contact. We do this as humans, and this is very challenged right now through distancing and the use of technology. And just wanted to share a couple of thoughts about this. It is a truly critical need for us and critical for our students, for our faculty, and so on. And in fact, it was one of the guiding reasons why we have invested so heavily in in-person learning experiences this fall. We can teach things online, but the added element of in-person social contact and connection deepens learning. It's such a fundamental need that we have. And again, that varies by people. For some that are more introverted, it might not be as challenging as some who are more extroverted. Technology is another interesting factor. And I've thought about, like, how would we survive COVID if we didn't have Zoom? How would we do something? We couldn't do this. So we, on one hand, have this incredible gift from technology. And on the other hand, there's a little bit of a double-edged sword too, right? Because it's not the same as in person. And even some of the really interesting observational studies of teaching that are coming out now show just how tuned in we are into response. So that if you look at a teacher lecturing to just icons or names on a screen, their affect is depressed, their engagement is depressed. The minute people start turning on their cameras, start looking at them, start smiling, start nodding their heads, their engagement increases. So we are hugely wired to social context and social contact. And that's a very positive thing. There's also the flip side too. You probably have heard this in your conversations with friends and neighbors and colleagues, like, social contact is a good thing, but when you're quarantined for months with like a group of people in a small house or in an apartment, there's also this negative effect of too much social contact. And so one of the interesting areas of research that's coming out of this is, what does that mean then for rates and risk for child abuse and for domestic violence? You might expect in those closed quarters, all previous research would say our rates should be skyrocketing. They're not. They're lower now post-COVID than they were before COVID. And if this were a class, I would ask you what you thought and why. But the answer is, it's because schools and other social gathering areas are closed, so there's not the recognition and the reporting. The rates are probably still high. They might even be higher, but we don't have the ability to assess and know. So social contact, an important thing, and just fascinating and nuanced in how we think about how it impacts us. Two more things to say, and then get on to the next talk. And again, I think about this in your life. Nearly everybody I have a Zoom conference call with, or a friend that you talk with, you do something like a virtual hug, or you do the icon with the hands up to hug, because just like with social contact, we're also hugely wired for physical contact and physical touch. Things like handshakes even stimulate our C-tactile afferent nerve ending, which stimulates the hormone oxytocin, which regulates good moods. And like any good drug, when it's gone, you miss it, you grieve it, and you want it. So we're craving human touch. And that is another thing that has been incredibly challenging with COVID, and leads to some of the challenges in mental health, depression, anxiety, and so on. So as a dean, and as you all as leaders, we're in this really unique position to think about how we support each other, and we support the needs of our students, of our faculties and staff. And so just a few more reflection points, and I'll just share them with you, but ways to think about helping to address some of the needs and some of the losses that we've had to cope with COVID. So those simple things like reminding yourself and reminding each other to breathe, to spend time outside. I know this is challenged by fires right now, but to exercise and to eat right. All these things are important for physical health, but they're really important for mental and emotional health too. Things like, as leaders, thinking about our calibrating and recalibrating our expectations for performance that are adjusted to the reality of life in the pandemic, but at the same time, not sacrificing career growth for people when we implement something. So how do we help people survive the immediate oppressive life, work, and stress it creates, but ensuring that the short-term tools that we provide are equitable, particularly for women, in how we apply them and what the outcomes might be. Providing compassion to acknowledge people where they are, and that it's okay to name it and say that the situation's hard. Some days we're emotionally spent and life sucks. That's okay to say. And then providing that hand that helps us refine our meaning and refine our connection and footing. And finally, extending grace in everything. And this is so important. The grace of understanding that everyone's coping with an unnatural, unpredictable, far from what we know is normal, longer than we'd like experience, and doing so in the very best way they know how. And here's the scientific underpinning for that. We know from a ton of psychological science that compassion, gratitude, and grace provide the recipient incredible benefits in terms of mental health and well-being. But the very best news about this is that it has really profound positive health benefits for the giver as well. So this is a win-win situation. Thank you.
Carol, you're muted.
Okay, can you hear me now? Can you hear me now?
Yep.
Our next speaker will be Phillida Charley, who will talk to us about the impacts of the COVID pandemic on Native American communities. Phillida?
Hi everyone, my name is Phillida Charley. I graduated from CSU in 2018 from the MIP department, so the Microbiology, Immunology, Pathology. And then these past year and a half, I've been postdocing in the Department of Environmental and Radiological Health Sciences. And through this, I was able to join a team here at CSU that we focus on One Health. One Health is you look at environment, animals, and human health all together. So our team focuses on uranium mining that happened in the past on the Navajo Nation. And what we're interested in is how all these different impact, mainly environmental, have on human health and livestock or animal health. So I don't know if you can tell, but so I'm a member of the Navajo Nation. This is really good for me because I'm able to go back more often to see, I still have family on the reservation. They're mainly in the New Mexico part of the Navajo Nation, and where I do my research is on the northwestern part of Arizona. So it's not that far off. And with so there's me and then there's 3 other people on our team. So not only are we looking at social impacts, so some of the items that were already listed, but I'm more looking at the livestock part of it, because what a lot of people don't realize is on the reservation, people don't have access to running water, which I've grew up with. You have to basically get water from a different source, not just tap water. And it's so many things you take for granted. And here in this, where we're at now here in Fort Collins, like all this stuff, like running water, running electricity, some of that stuff people take for granted. And when this pandemic happened, a lot of it, we were kind of like stumped because we're like, okay, the Navajo Nation had high rates of COVID infections, a lot of deaths. My family, every couple of weeks, my mom's like, oh, you know, somebody so-and-so passed away. So it affects me too. It affects everybody on the reservation because you at least know somebody of somebody who either the parents passed away or somebody they're related to passed away. So with our research kind of got stopped currently because we didn't want the chance of infecting more people. Like if one of us had it, we didn't want to go on the reservation and then give people COVID even more. So the area we work in, technology is not, I would say, is not fully reliable. Phone service is hard to get in that area we were working in. So just some things, it's like, not only are you commenting, telling people like to take care of, to wash your hands, but how can you wash your hands if you run out of water that you hauled from a different place? So things like that. So when you think about this, it's not only affects Native American more highly, but it's also, there's all sorts of things impacting them. So many right now, I like to say, because all our kids are in school right now. Here we have the ability to get Wi-Fi access for them, get them computer access, but they are trying to, so several people I know when we're talking about this is that, you know, I just said technology is not reliable there. And with online learning, a lot of the students are missing out. We can't get them clear access to like clean Wi-Fi where it can keep running. You can stay connected and not go in and out. So their ability to learn is I would say lower, because many of them don't really have access to some of the items here. So when you think about this whole COVID thing, it's really hard. It's hard on Native American communities. I know because I talk to my parents all the time, and they tell me just this past, like last 2 weeks, the Navajo Nation's seen an increase of COVID cases again. So what happened is they went into lockdown. So lockdown is where you're not allowed to be out at certain times, and especially this in the Navajo Nation, they're not allowed from 5 p.m. to like 8 a.m. in the morning, so all night, or else you risk fines. What other impacts is, you know, with all this curfew time, they have to, so let's take my parents for example, they have to get food at a certain amount of time. So they run to the store. You have to be done before 5, but what they have to do is wait in these long lines with limited capacity for certain stores. You're only allowed like certain amount of people in the store. So they wait in these long lines just to get food. So many people will actually just like, you know, forget it, we're not going to do that, we're going to go do something else. So it's many different things that, you know, it's all of them, I would say, is impacting these Native American communities. So and what's I really like to point out is many Native American communities do not just have a single household, they have multiple households living in one dwelling. And with this, when somebody gets sick, this leads to other people getting sick within the family. So it's hard to quarantine with, you know, you have your family with you. It's hard for one person to quarantine when, you know, you only have that one dwelling. So, but one thing I would just like to say is just keeping in mind, it's many factors with this whole COVID thing impact Native American communities. And that's why we're considered a high-risk group. I don't know if anybody seen so far some of the stories done on the news, but they're like little 5-minute short stories at a time. But that's where my research and my research area is hopefully going to head that way. All right. Carol, you're muted again.
Muted again, sorry. Thank you, Phillida. I'm sure we'll have some more questions for you too. And our next speaker, and I guess our last speaker, will be Pat Alois Young, who is going to talk about the changes in carbon emissions during the pandemic and how we could possibly sustain those. Hey, Pat.
So I think that the plan to have me go last was a really good one because I'm going to try to cheer you all up now. So my research really focuses on behavior change. And because of the fact that I'm in psychology, I do want to emphasize that I'm not talking about like doing therapy and, smoking cessation and things like that. I'm talking about large scale behavioral interventions. And so in our lifetime, this is a behavior change, campaign of unprecedented magnitude. What we've seen is that, if we think about things that have happened in the past, like wearing seatbelts or, adults smoking, those changes have happened over, literally decades. Here, what we've had is massive behavior change all across the world virtually overnight. And so a lot of people are talking about, when are we going to get back to normal? Can we please get back to normal? I really crave being back to normal. And so my question is, are there any changes that we've made during this pandemic that we would actually want to sustain, that are actually positive, byproducts of this situation? And so one example that a lot of people are talking about are carbon emissions. And so on the slide here, what you see is that NASA has taken some pictures from around the world, really, of pollution levels in metropolitan areas before and after COVID. And so, for instance, this is NOx emissions, and on the left you have the average level of pollution over a 4-year period, because some of this stuff is variable with weather patterns and things like that. But you can see that from before COVID to after the lockdown, what we have is about a 30% reduction in this pollution. And so, around the country and around the world, places like LA have had the best air quality that they've had in living memory. And so what are the things that are actually driving this? Well, so with some colleagues at the Energy Institute, we've actually looked at energy consumption. So for instance, electricity use is one of the major contributors to carbon emissions. And so what we did was we looked at the electricity use in residences compared to commercial and educational properties. And so, one of the big things that's happened, obviously, is that a lot of us are working from home. So how does that impact our electricity use? And there has been a slight uptick in electricity use in residential properties, which you would expect with, kids at home and people and parents at home working from home. But there's been a bigger drop in the commercial usage than there has been an increase in the residential. So overall, it's a net gain. We've actually reduced our electricity consumption. And this is actually one of the things that we should be thinking about going forward is telecommuting. So, telecommuting is not new. It's been around for, as long as computers have been in people's homes. And what happens is that it kind of, it increases in popularity, and then all of a sudden it wanes and it kind of ebbs and flows. And so even right now, we have an unprecedented number of people who are telecommuting. And right now, it's actually a drain on women because of the fact that children are at home. But under normal circumstances, when children are at school, telecommuting is actually great for women, because anything that gives women a flexible work schedule actually improves their outcomes. And so, if you think about, my kid's in a play and I want to go at 2 o'clock to go see that, normally I would have to take off work for the entire afternoon. But if I'm telecommuting and I don't have that time spent in the car, I can go for that hour, an hour and a half, and then I miss a minimal amount of work, and it's actually time that I can even make up. And so what you find is that people who telecommute and businesses that have these practices, they have greater productivity, They have fewer sick days and personal leave days. There's less turnover. They save money because of not having to provide the workspace for their employees and to pay the bills, you know, in terms of electricity and everything like that, and that are huge costs for these companies. And so it's a win-win, because it's a win for the environment, it's a win for the employer, it's a win for the employee. And so what you're seeing, though, is that a lot of people are really burnt out on the telecommuting, and they're thinking, God, no, please, I don't want to do this. But what we need to be thinking about is, you know, giving people options. So there are some people who do want to be back at work, and they should be allowed to go back to work. But there are a lot of people who are going to do better with telecommuting, and it's going to have great environmental benefits. In the public health arena, washing hands. I mean, how many times have we heard during flu season, wash your hands, wash your hands? And in fact, now we're actually getting that behavior change. And it'll be interesting to see whether we actually get a milder flu season than normal because of these public health practices that people have adopted. And the surveys show that people are intending to continue these public health practices even beyond the pandemic because they're habits. We've had long enough in this lockdown that we've actually been able to form some of these habits, and hopefully we'll be able to sustain those. For instance, meal planning. You know, we can't go to the grocery store every day anymore, or, you know, we're trying to avoid it. Are people actually doing meal planning, which can help to reduce food waste, and it can improve both health and economic benefits for families. So I think that there are a lot of potential positive outcomes that have, you know, the potential to pay forward in terms of lasting benefits for people, even though right now it might not feel that way.
Okay, well, thank you, Pat. Now, looks like we've got everybody on the screen. So, well, I'd like to ask a couple of questions, but I know there have been some questions posted on chat too. So, should I go ahead?
Hey, Carol, this is Candy.
Yeah.
In keeping with what Lisa just mentioned to us about needing to see each other and wave at each other, could we all come on screen long enough to wave at the people that you are in this meeting with? There are 56 people that have joined us today, and so thank you all for being here and for connecting with us like this.
Yes, thank you.
Also in keeping with that, I think, yeah, thanks, Lisa. I see your heart. And, it seems reasonable to me maybe to ask the people that have asked questions to unmute, and I can just guide us through the...
Okay, that sounds good.
Okay, I'm going to go away again. And then Erica, you had some questions. Would you like to start? You are muted.
Sure. I was trying to unmute myself, but I wasn't very fast. So I have two questions about the wastewater treatment or testing. The first is, are we testing buildings outside of the dormitories on campus? And the second is there evidence that fecal material can actually transmit? I know you said during the chat that it isn't transmitted by wastewater, but is it transmitted by fecal material? Like toilets aerosolize a ton of fecal material. So is there any evidence that they're getting transmission that way? Because I know that there was evidence with SARS-1 that it was transmitted that way.
Yeah, sure. So your first question was about whether or not we're monitoring buildings outside of the dorms. You mean like academic buildings on campus?
Or like Clark, where there's lots of teaching going on, lots of students.
Yeah, so we've had many ongoing conversations with the leadership at CSU about, you know, the pros and cons of that idea. I've pointed out multiple times, and, you know, pointed out here that, and this is a, you know, a behavior thing, so maybe Pat can help me. We think that the main place that the virus is shed in wastewater is through feces, and so we have not chosen to monitor buildings with teaching because mostly people come into that space, they're there for an hour, they leave. There have been conversations about monitoring buildings where a lot of research is happening, such that people might be doing longer spans of the building. But for now, we've really focused on residences because we're trying to capture a signal that is, typically coming from fecal matter, and it's just habits. We can just kind of guess where we're most likely to find that signal. It's also most actionable because it's easy to know. Who lives in a building, whereas with teaching, other people can come and go and use the restroom, right?
Yeah.
The second question about whether it can be transmitted through wastewater. So, once you have wastewater in the sewer system and it's making it to wastewater treatment plants, at the wastewater treatment plants, it's been studied whether or not the virus could make it through a wastewater treatment plant and be infectious on the other side. And so far, the answer to that has been no. We're not worried about the virus being shed by wastewater. And, we have closed sewer systems, and there hasn't been evidence that, professionals that work at wastewater treatment plants are seeing, transmission from their jobs.
But what about toilets?
I haven't seen that so far. Yes. And then the last thing is toilets. And, some of us have seen those videos where if you flush with the lid up, there's aerosolization. And so I'm not an aerosol specialist, and so I don't want to give you a definitive answer. But other faculty in the College of Engineering that study aerosols have pointed out that should be a cause for concern. Some of those particles are large enough they'll settle out quickly. I don't know the latest science on how likely or like how major of a transmission route that is. Personally, what I read is if you can wait a few minutes after the last person has used that restroom so that some of those aerosols can settle out, that would be safer.
Thank you. Thanks for the question, Erica. Christy, you also had a question on wastewater.
Oops, I'm trying. Oh, my camera's not working. Can you hear me?
Yes.
I'm sorry. I don't know why. You probably saw my question. I'm wondering with that wastewater data, can you predict how many people might have COVID?
Oh yeah. That's I saw that question. That's always a question that comes up. The answer is right now, no. And there are a few reasons for that. One is that people shed the virus at different rates. And the range is orders of magnitude. So major differences between the amount of virus that one person is shedding versus another. And that can vary between individuals, by age groups, and also over the course of an infection. So it becomes very hard to just try to do that math. The other challenge is that what we call sewer sheds. So if you know about watersheds, rivers and small tributaries that connect to a big river, well, you can think about the sewer system as a shed like that. They're complicated, so there can be various inputs. So if you're looking at an entire region, there could be an industrial input. So it can be difficult to, deal with the complexities of the system and therefore predict the number of people that are infected. There are some efforts and models that have been developed to try to hone that a little bit, but the answers end up being so variable that it has not been useful. It's not useful to say either 1% of the people or 100% of the people are infected. So right now the answer to that is no, but there is ongoing work, and maybe we'll get to a point where we have a better answer to that question. Right now, the key is to look at trends over time. And that will, if you have a major increase off of the levels that you've seen over several weeks, then that trend from your baseline tells you that there's an increase in infected people, and that becomes actionable.
Thank you.
Thank you, Christy. There's one more question here that Dr. DeLong answered in the chat, but I think it's worth having our panelists ask the question. Janice, your 12-year-old had a question, which I think is a really good one. And please ask your question, and then we'll go back to Dr. Blair for some questions on other things.
All right, here he is. So I was thinking, because we were learning about microbes and bacteria in science, and some of them live inside the body and help defend against viruses. So I was wondering if it would be possible if we could biogenetically engineer a bacteria to fight coronavirus.
That's a really good question. We certainly know that we have a microbiome. That's actually what I study. Normally, I study microbiomes in various systems. We have a microbiome, which is all the microbes, all the bacteria that live on and in our bodies. The majority of those are in our gut system, so in our digestive system, and they do help us in a lot of really important ways. So it's important to recognize that. Whether or not we could genetically engineer a microbe to help us is a good question. I know that there are some people that are trying to genetically engineer bacteria to produce vaccines. That would be like taking a probiotic. If you know about probiotics, that you can buy, bacteria that you take, like yogurt or pills that introduce useful bacteria into your body. There are people that are trying to engineer those to produce a vaccine. It's important to think about with the coronavirus, a lot of the infection is in the respiratory system. And so we don't, normally have probiotics that go into the lungs. So we'll need a way to get that defense system, into the respiratory system as well. But maybe that's something that you can work on.
Okay.
I think that's a great idea. And speaking of engineering bacteria to make vaccines, Greg Dean in our department is doing research on just that.
Mm-hmm. I'm sure I read it somewhere.
Carol, if you had other questions that you'd like to ask the panelists.
Oh, there are some more questions over here. So let's see. Well, somebody was wondering about mutations in the virus. And yes, there have been mutations. There have been people who have done the genome sequence of maybe 3,000 different isolates of SARS coronavirus 2, and they have found various mutations because that's what RNA viruses do. But there's only one that seems to have been positively selected. It is in the gene for the spike protein, which is the protein that vaccines are directed against. But so far, it has not changed the immunology of the protein. And so if a vaccine is successful against the first SARS coronavirus that was isolated, it will probably be successful against all that have cropped up since.
That's reassuring.
Yeah, it is. Erica had a question for Phillida too.
Phillida, do you feel like the Native American communities are getting the resources that they need during this pandemic? Are resources being adequately allocated?
I would say not fully. I know the Navajo Nation had a shortage of PPE, basically like gloves, mask, protective covering. There was some of the hospitals there that they didn't have it. So it was like trying to scramble for it. So there's some stuff like that. There has been this like donations of food and water, but you have to kind of know somebody who knows somebody to know when that's happening, when to go. So it varies. So.
And I see a question from Dan Powers, and it's directed at anyone who knows the answer, and that is, what information sources do you recommend for Colorado-focused detail?
The Larimer County Public Health Department has a really good website that's really good specific for Larimer County. And then Johns Hopkins Medical School has a really nice website where you can look at any county or any state and you can get a feel for the mortality rate, the case mortality rate. So if you can get lots of different statistics and the number of cases in a different particular area. These are the ones I use.
Yeah, thanks, Erica. That's very good recommendation.
And it's updated daily, so I think that makes it really helpful to keep track as well.
Yes.
The one at Johns Hopkins.
The IHME one, the one that does the modeling, used to have it broken down by all the states, but about 3 weeks ago, they went to just the United States and they got rid of all the breakout of states, which was unfortunate because that was very helpful.
Yeah.
There's another question in here from Pat. Pat, you want to ask your question of Susan?
Sure. Susan, are there any plans to start monitoring the schools as PSD goes back live for wastewater?
Yeah, I mean, not that I know of. I've been contacted by various people connected with the schools. I think, you know, even though this method is really cost effective and it can work, it's no small undertaking. At wastewater treatment plants, we have the benefit that they always sample their influent as a normal process. So they're all set up to do it. They have compositing pumps at the influent of the wastewater treatment plant. So for them, the way that we're doing it for the state, all the wastewater treatment plants that have participated in our collaborative, we're calling it the collaborative with a big C, big O, are collecting those samples and sending it to us at CSU. It's not a big ask for them. At CSU, where we've been monitoring at the sewers, we've had to install these compositing pumps that we hang down in the sewers. And I mean, basically, we're monitoring 3 times a week, and basically every day there's an email about 5 things that went wrong that I have to try to deal with. So it's not as easy as I made it sound. So those pumps cost, you know, a couple $1,000s. So I think that this is a tool that we may see getting adopted more and more. And it's kind of like what Pat was saying about behavior changes. If we start purchasing these pumps and getting our infrastructure set up so that wastewater epidemiology is something that we're just set up to do, it would be quite easy to then, you know, change what we're monitoring because we're already collecting a sample. But to my knowledge, we don't have plans to monitor the schools. In the contract that we have with the state, it's a $500,000 contract. It's mostly this broad surveillance. We have a small budget for micro sewer shed monitoring to like look into small areas, but so far it's not clear that it would probably be allocated for schools. There's just a lot of schools in the state of Colorado. So I think it's a great idea, but no plans to do it yet.
Thanks.
May I ask Rebekah a question? You talked about your work in Africa, looking at bats there. And we, of course, know that the coronaviruses have originated from bats in China. So tell us, is there spillover of viruses from bats in Africa? Not necessarily coronaviruses, but others.
Yeah, that's a great question. Yes, there have been. Probably one of the most well characterized is Marburg virus, which is a filovirus related to Ebola virus. And so that's the Egyptian rosette bat, which is a cave-dwelling fruit bat in Africa, is the recognized reservoir for that virus. And it does spill over and cause outbreaks in tourists and in local people who enter those caves. And so that's one that would be kind of a direct transfer. I think with coronavirus, it's more complicated if there's immediate hosts involved and recombination among virus strains. But that's one of the ones that's kind of close to home when I'm working that we have to be aware of.
Yeah. And how do you protect yourselves then when you go into these caves?
Well, yeah, you might have noticed the PPE in one of my pictures on the slide. So we definitely are wearing respirators. We're half-face respirators when we're in the caves, and that would be for any potential, the threat of the unknown that might be aerosolized that we're dealing with. Also wearing either a Tyvek suit or a closed front gown, boots, gloves, leather gloves for handling the bats to prevent bites.
Right.
A hard hat, face shield. So it depends kind of the risk based on the different situation. But certainly when in a cave with the Rosettas, we're talking about tens of thousands of bats all congregating and defecating, and and so the histoplasmosis is also present. So there's lots of consideration for physical as well as respiratory protection.
Okay, thanks.
Kendra, you had a question. Would you like to ask your question? I think this one is probably to Lisa.
Oh, yeah, I was just wondering, you talked a lot about the negative psychological effects just from, being apart from people in general, but I was wondering if there's been any noticeably positive effects with regard to like increasing connectivity with family and friends that like might not live in the same, that you might not necessarily talk to on a regular basis under normal circumstances.
Yeah, so that's a really great question, and I love when we can flip thinking about what positive outcomes of things. So I think again, it's a nuanced answer probably, and I will say straight up that I'm extrapolating a little because I don't know that somebody's looking at this specifically, but yes, one might expect positive psychological effects with increased communication, the ability to connect more often, more frequently with families and friends, particularly those that are at a distance. Certainly easier to hop on a Zoom call than the effort in traveling. But I'm a little cautious in saying it's like an amazing positive outcome because think about some of the things we talked about before, the ability to see each other. So if there's a visual component to that communication, potentially outcome is better than if we're just chatting where you can't read affect and you can't know what people are saying. So I think the increased risk of miscommunication, the freedom people feel sometimes to say things in a text or a verbal format that they wouldn't necessarily say in person. I think there could be challenges there too, but I think the technology that's afforded to us by Zoom, by Teams, by being able to connect with people is certainly better than if we didn't have this, it would be a much harder way to and that distance and loneliness and disconnection might feel even more profound.
So if I could just add something. Kind of following from the idea that necessity is the father or mother of invention, I think that there is a potential positive outcome from this in older adults becoming more familiar with technology in order to be able to maintain contact that they're missing because of, they're self-isolating because they're at elevated risk. And so I think that there may be some positive outcomes with regard to that specific demographic.
Oh, sure. I think with learning the technology, but then also the next step of actually connecting and seeing lower loneliness and so on. I actually had a question. Can I ask one, or are we instead of typing it? So, and this one actually is right back at you, Pat. So I'm very intrigued by the idea of, behavioral change in this just bizarre circumstance we find ourselves in. And so I have two questions about sort of the long-term commitment to behavior change, right? So the motivation for a lot of behavior change interventions is a direct one to you. Climate change is hopefully a direct one, but it's a little more amorphous potentially. So how do we maintain that motivation? And then secondly, from a lot of intervention work, that a single boost or dose of an intervention isn't as effective as repeated boosts. And I'm not saying we should have another pandemic to really hone the message here, but what is the long-term strategy to capitalize on these really positive gains for our planet?
So I think that there are two aspects to that. One is that when you talk about long-term behavior change, and it is really a challenge, one of the things that you have to work towards is developing habits. And because of the fact that this is, although it is one burst, it's a very long burst. And so I think that there are actually opportunities for some of the behaviors that we've developed to be habits. And, if you think about this, one of the indications of a habit is that it happens automatically, right? And so you may not even be aware. You think to yourself, did I do that or did I not, right? Those are sort of some of the manifestations of a habit. And, just when I get into the car, I automatically do the hand sanitizer, right? And it's something that at the beginning I was really thinking about, but now I'm not. And so I think that there are going to be some things that have become habits. And so, I think that's one of the positive, again, I'm trying to be the positive person here. The fact that we've been stuck in this Groundhog Day for, 7 months, at least it does mean that some of these positive behaviors like the hand washing and potentially the meal planning and things like that can become habitual. With regard to the motivational aspect, I think that, one of the things that we do in our work is to focus on what are those individual motivators. So if you notice when I talked about telecommuting, I talked about work-life balance, and I talked about, having the flexibility to go to your kids' play and things like that. Those are the things that motivate people. If we talk about, commuting, it's really the most stressful part of most people's day. And that's how we want to sell it. We don't want to sell it as, here's the carbon emissions over here, because as you say, it's not something that's touching your life on a daily basis at this point in our lives. So there are a lot of more direct benefits that we can focus on that are going to motivate people more than the global climate change.
Thanks. There's another question here in the chat, Carol, from Shannon for Drs. Charley and DeLong.
Okay. Shannon, do you want to ask your question?
Sure, I'm happy to.
Hi, Shannon.
Hey, Dr. Blair. It's good to see you. I am curious, and this is to anyone, but I'd like to start with Drs. Charley and DeLong. Do you have ideas of how we can equitably provide access to wastewater epidemiology as we develop this technology?
I'll just jump in first because we've already had that discussion. Because we're working with the Colorado Department of Public Health, here in the state of Colorado, this wastewater epidemiology has been funded by the state. And so I've brought this up multiple times, and we did make some changes to the communities that were included in our collaborative that were covered by the state contract, considering the idea of equity. I don't know. There's more to do. There's more to do. Unfortunately, the budget still had a max on it, and so we couldn't do every single community. But I think the way to do it is to have it funded at the level of state government or national government, as opposed to expecting wastewater treatment, districts to pay on their own dollar. We've also been driving the costs down. So the amount of money, when this started, a lot of wastewater treatment plants were sending their samples to a company in Massachusetts that originally said they would do a number of samples for free and then started charging $1,700 a sample. And we are charging $250 a sample. So.
Wow. Dr. Charley, do you have anything to add to that?
I think it's kind of hard too with the rural areas. Many of the rural areas, some of them just do outhouses. And it's really hard because some of them are not even hooked up to the wastewater plant. And it's pretty hard. You would have to really advocate for some of the rural areas to get wastewater tested. And we would probably have to figure out a way to talk to certain people, because some people do have septic tanks, I know, and some people just have outhouses. It's that simple.
I think one new technology that's coming online as I'm listening to you is, the university here at CSU, we're working on pooled spit testing. So this idea that, everybody spits in a bucket, and that might be a little bit easier than having to send my crew out with a shovel to the outhouse. So, I think it's just a matter of understanding the system.
Yeah.
And then figuring out what the best tools are for that system. And it doesn't have to be a wastewater treatment plant implant. There are ways to get where we need to go with some research and development.
So did we answer your question, Shannon?
I'm just, that's where I live. So I'm just trying to think about making sure that the communities most impacted also have access to the tools. But I understand the outhouses. I do.
Mm-hmm.
Any other questions out there? There's nothing else on the chat. So Carol, if you had other questions.
I don't have a question, but I wanted to tell Pat about something I just read. And it was, there was to be a meeting of mathematicians in Europe. And then it was canceled. And so two of the young people who had been due to present organized a virtual meeting that was unlike anything I had ever heard. There's actually a technology company that has organized a way to rent a building, virtual building with many rooms. So then in it, you can hold a big scientific meeting where one room is for socializing, another is for a workshop, another is for a keynote address. And so you can just plug in to the room that you want to go to at the meeting and participate. And they said they liked it because it reduces carbon emissions because there's no travel involved, and it drew a much wider audience because it allowed participation of people from all over, not just Europe, but from all over the world. So I thought that was a great positive outcome of the pandemic.
Cool. There's another question that just popped in the chat, and Isaac doesn't have a webcam or mic working, and so I'm going to ask the question, and it's for you, Rebekah. I have never thought about viral transmission from humans to bats, specifically in the context of spreading diseases. Do human populations tend to pose significant threats to other species?
That's a fantastic question, and I think that this pandemic in particular has really kind of turned us on the flip side to think about things in that way. But it is something you think about spillback, and I know it's been a topic of concern for endangered great apes and human contact with spreading disease back into nature. Cross-species transmission is, there's a whole literature based on this with pathogens moving, parasites and bacteria and viruses from one species to the next. In the context of bats, we don't have a great example of that happening yet, but the risk, some of the conversations and talking with some of the bat ecology researchers is that, a common practice for them would be to hold the bat and blow right on the bat to assess nipple condition and look at various things and have very close proximity. Or in the context of bat and rehabilitation, you'd have a bat in close quarters for a long period of time. And so the exposure risk would certainly be there. Whether or not the bat would get infected is a whole nother question. But probably, the example that I can think of is with, as far as human risk to spreading a pathogen that impacts bats is white nose syndrome, and it's a little bit different of a situation. It's a fungal disease that's been decimating bat populations in North America. And people, have been tracking the fungal spores from cave to cave, and that establishes it in the bat population and kills the bats. And so that, is kind of an anthropogenic risk that we pose on the pathogen front to bat population. So it's not the same thing, but it has kind of brought to light that, there is this risk that we need to be aware of, while we're still trying to learn and figure out, the credibility as far as the infection potential, but the exposure risk is there, I think.
Any other questions for our panelists today? Carol, do you have other questions?
No, I don't, but I have been fascinated by everything all of you had to say. Thank you.
I know, I'm so fascinated by it all as well, and really appreciate each of you coming and spending this time with us today. This has been fantastic. Thanks all. Okay, thanks Erica. We're all gonna clap.
Thank you.
Now.
Thank you. Thank you.
See you all in December.
Thank you.
Take care. Well.